Welcome to Academics in Nutshell, and today we will discuss periodic fever. Whenever a parent brings a child with complaints of periodic occurrence of fever, first we must ensure that the temperature is recorded properly. Considering the various causes of periodic fever, the commonest are the recurrent infections, especially the viral infections, the upper respiratory infections, UTI, and few others. Among the non-infectious causes, the inflammatory disorders like psoriasis, Behçet, and other rheumatological conditions are common cause of non-infectious inflammatory disorders, but particularly the PFA-PA that I will discuss soon is of importance. There are some neoplastic like lymphoma which may cause periodic fever, and some are hereditary periodic fever disorders. This is a 5-year-old girl with fever, sore throat, painful lip ulcer. There were cervical lymphadenopathy on examination. There were no rash. Interestingly, there were two similar episodes previously in the last 2 months, and the child was absolutely well in between these episodes. The routine investigations did not yield much. The WBC count was normal, platelet was high, and other investigations were insignificant. This is a typical presentation of PFA-PA, that is periodic fever, aphthous stomatitis, pharyngitis, and adenitis. Now, among the hereditary cause of periodic fever, the Mediterranean fever does not occur in India. The second most common of hereditary periodic fever that we might encounter is the tumor necrosis factor receptor associated periodic syndrome, that is TRAPS. It is an autosomal dominant, presents with high fever which may last for more than 7 days, and typically there is localized pain and tightness of muscles which is often migratory. There may be arthralgia, skin rashes, periodontal edema, and sometimes mouth ulcers and testicular and abdominal pain also. Here in the investigation, the neutrophil count and platelets, the CRP, ESR are all raised with some complement activation also. The serum IgA and IgD are typically raised. The treatment is high dose of steroids at the beginning of the attack, and it reduces the severity. Then there are other medications also. Thank you. See you again.